What's going on, Wellness Gang? Welcome back to Embodied Wellness Radio, a podcast framed around making women healthy again. And Happy New Year to all of you. I am so excited to be hopping into this new year, bringing you weekly episodes every Wednesday on Wellness Wednesday, chatting all things hormone health, female health, digestion, and everything wellness. So today's episode is something that I often talk about, and I have multiple posts on my social media, but I felt like it was definitely worth having as an episode and getting a little bit more into exactly what we mean when we talk about IBS and why it's potentially not the best diagnosis in the world. And IBS is something that is very commonly diagnosed based on symptoms, which we'll get into. And many women who are diagnosed with IBS, and men as well, are told that there is no cure for it. So we're going to talk about exactly what that means and answer the question, as the podcast title suggests, of is IBS a bullshit diagnosis and can it be cured? So before we get into it, it's important to know what the heck we're actually talking about. So what is IBS? IBS stands for irritable bowel syndrome, and it's important when we talk about the definition to understand what a syndrome is. So a syndrome is a group of symptoms that occur together. So anytime we hear something as a syndrome, that means that it's diagnosed based on symptoms. So what this also means is that the diagnosis is not given based on any sort of laboratory testing or anything that's measured or looked at in the body, but rather what the patient reports to the doctor when they're in the doctor's office at the time. So IBS, again, is a diagnosis based on symptoms, and it's actually a category of functional digestive disorders. So because it's based on symptoms, that means that if the symptoms were to go away, then the diagnoses would also go away. So in this case, the way that a doctor would diagnose it is two symptoms. Number one, there needs to be some sort of pain, so pain after eating, abdominal pain, discomfort, and there also needs to be changes to bowel movements. So there's different types of IBS. They have IBS-D, which is IBS diarrhea. There's IBS-C, which is IBS constipation, and there's also IBS-M, which is mixed. So some people may have alternating constipation and diarrhea depending on the day, but those are the different categories which all fall under the IBS diagnoses. So just because those are the two symptoms that are necessary for a doctor to diagnose, that doesn't mean those are the only symptoms. So many patients who receive this diagnosis also experience lots of other digestive symptoms, which could be bloating, gas, heartburn is very common, indigestion, burping, feeling of fullness in the stomach after eating, and then also some symptoms that may not seem digestive related, but as you probably heard me talk about a million times, nothing in the body happens in isolation, and especially when we're talking about gut health, what happens in the gut does not stay in the gut. And so these clients or these patients will also experience an array of other systemic issues. So this can be chronic fatigue is extremely common, mood disorders like depression and anxiety, headaches, skin issues. So that can stem anything from acne to even eczema, skin rashes, psoriasis. And again, these symptoms are not necessary for the diagnoses, but they are extremely, extremely common and present. So going back to what I mentioned with IBS being an umbrella term, what does that mean? This means that the IBS diagnosis, which again is based on symptoms of abdominal discomfort and changes to bowel movements, could also be a lot of different things. So there's many different disorders that also, or imbalances rather, that also cause those symptoms. So these can be things that are very common as well, like SIBO is a really common one, dysbiosis, even parasites, and we'll talk a little bit more about that later on. But it's important to know that because it is based on symptoms, there are reasons why those symptoms could be occurring that are causing the IBS diagnoses, and unfortunately, doctors are not testing for these. So how does somebody get this diagnosis? So typically what would happen is somebody's experiencing digestive issues. Maybe they are having diarrhea all the time, constipation, maybe alternating between the two. Maybe they're experiencing a lot of pain when they eat or any of the symptoms that I listed. So they probably are going to go to see their doctor because for most people, when they have health issues, they assume that the doctor is going to be the best person to help them. So they book in for an appointment, they go to see their doctor, they say, hey doctor, I'm experiencing a lot of diarrhea, or I'm, going to the bathroom 6 times a day, or I haven't pooped in 6 days and I'm thinking that's a little bit alarming. And your doctor will probably give you some very blanket advice to start, like, maybe you should eat some more fiber, or maybe you just need to drink some water, or maybe you need to manage your stress better, or maybe you need to go on antidepressants or birth control and try to prescribe you something. And so the first appointment for many people may be just some general blanket advice, or they're dismissed and said like, oh, it's not that bad, or try these things and then come back to see me. So let's say they do try those things and they go back to see their doctor. Their doctor will likely take, okay, does this person have abdominal pain? Do they have changes to bowel movements? And say, all right, you have IBS. And the person may say, okay, so what's next? Nothing. Nada. Shit all they're given. They're told that it is a diagnosis that cannot be cured. They're not usually given any more information outside of maybe like eat some fiber and take a probiotic. And they're not really explained what that means. And the doctor, again, hasn't done any testing. So the doctor really has no friggin' clue why the person is having those symptoms. So how the heck would they help the person, right? They're just told this is the label that you have. This is the diagnosis, and be on your way, pretty much. And the problem here is that the person is still suffering. Outside of a diagnosis that labels what they have been given absolutely nothing to help with the issue that they went in to see their doctor with. Maybe if they're really lucky, they'll get a referral to go get an endoscopy or colonoscopy. If they're lucky, they might be referred to a gastroenterologist. But for the most part, they're just given a diagnosis, given some very generalized advice, and told to be on their way. And now the person thinks, holy crap, I have to live with this for the rest of my life. And, a lot of people innately trust their doctor with their health, which we should be able to, rightly so. And so they just think, okay, this is just what it is. Maybe they go home and they go to Dr. Google and see like how to treat IBS. And a lot of the articles that are online, and especially the ones that are going to come up first, are a lot of the time funded and from the medical system and are giving you the same blanket advice. So the problem here is that, again, like the person who went in for help for their symptoms has not been given help for their symptoms. They've just been given a label. And the other thing, which I mentioned at the beginning, is that there are so many things that can be tested for that would drive IBS symptoms and therefore classify somebody under that diagnosis. And without doing any testing or any investigation to what's causing those symptoms, they are going to be really difficult to resolve. But with proper testing, when we identify why the person has the symptoms in the first place and work on healing and correcting that, the symptoms go away and the person no longer has the IBS diagnosis. So did we cure IBS? Well, maybe, right? It depends on the definition. There might not be a cure, but we can get somebody undiagnosed or where they no longer qualify for that diagnosis because the symptoms are no longer present because we figured out why the hell they were there in the first place. And this is really important because this method of thinking or this understanding about IBS actually helps people. And, doctors, this sounds like I'm putting a lot of shade to doctors, but really they're just doing the best with what they can. And the stat is that the average time it takes from something that becomes relevant in the literature or that's been studied to actually make it into the medical field is about 17 years. So some of the testing that we have available, like GI maps and even like SIBO breath tests or some of these relatively newer tests, haven't had a chance to make it into the medical system. So your doctor maybe doesn't have as many tests available to actually figure out what's going on. They also only have about like 6 to 10 minutes with you in an appointment. So during that time, they can't do a full in-depth intake. Like if you're a client of mine listening to this, you know that my intakes are definitely taking longer than 6 to 10 minutes to fill out. And I really want to get to know the person and all their symptoms and all of these other things that can influence digestion. And the way that the medical system is set up, just unfortunately, they can't give you that time, right? So they really are, most of the time, doing the best with what they can, We also need to understand treatments and what is covered by insurance for a doctor to prescribe or to give to you. So some of these conditions, can actually be treated in the medical field. Let's take like even SIBO. You could treat SIBO technically with antibiotics, parasites, same. There are actually medically sound treatments that you can have from conventional medicine to treat some of these things. But a lot of the like quote unquote root cause or influential factors, or looking at why the person got to this place with their gut health, things like stress, or maybe it was antibiotic use, or maybe it's under eating or chronic dieting. They aren't really well equipped to help the person there. And even working on something like intestinal permeability, let's say, they don't necessarily have the insurance to back them to be able to prescribe things like supplements, which are going to be really beneficial and really therapeutic for these people. So there's also an issue of, even if they run the test, maybe some of the things that come up on the test, they can't legally help you with, or within their scope of practice or within their knowledge, are unable to help the person. So there are a few inherent things where it's not just like negligence on the doctor's part, where they don't want to help you. They might not have proper testing available to them. A lot of the time they don't, unless they are sending you for something like a colonoscopy and or an endoscopy and find out you have like IBD, different things like dysbiosis, they're not going to be able to test for and potentially not be able to help you. So yes, there are some inherent issues there. And at the same time, it's also not cool, for lack of better words, to just tell somebody, here's what your problem is, you have a label now, but not give them any help. So IBS is kind of just like, we have no clue what the F is going on, so we're just going to give you a label and send you on your way so that I felt like I gave you something. And I have worked with numerous quote unquote IBS patients, or people who have been given the IBS diagnosis either by a doctor or self-diagnosed, and have helped them completely heal their gut to the point where they have no symptoms, and again, no longer classify as that diagnosis. So how do we do that? Going back to what I mentioned, number one, find out the cause of the symptoms. Why does the person have abdominal pain? Why is the person having diarrhea 6 times a day? Why can't this person go to the bathroom more than once a week or once every few days without using a laxative? Why is this person alternating between constipation and diarrhea? So number one, find the cause of the symptoms. Number two, fix the cause of the symptoms and address it. Number three, IBS gone, no longer classifying under that diagnosis. So what are some of the things that cause the IBS symptoms? Or when I'm running tests for clients, or when I'm helping people work through that diagnosis, what are some of the things that are coming up on these tests that could be driving it? So number one, I would say this is the most common, is dysbiosis. So a lot of people have heard of SIBO, which is small intestinal bacterial overgrowth. That's one thing that falls under the category of dysbiosis. We could also have, overgrowth of harmful or potentially negative bacteria in the large intestine. We could have low levels of healthy bacteria. And these can happen due to lots of different reasons: poor diet, chronic stress, over-exercising, under-eating, antibiotic use. Some medications can cause these. And there was a meta-analysis that was done recently that shows over a third of people who classify as the IBS diagnoses do have dysbiosis, or in this case, they were looking at SIBO specifically. Some of the studies that are within that meta-analyses or the review did also show up to 70% of people. So this is, again, a very, very common cause. I would say in running GI map or stool testing for people, I see this come back in some way, shape, or form, either low healthy bacteria or elevations of dysbiotic bacteria, almost 100% of the time for those who have had IBS. So very, very common that dysbiosis is driving this. Another reason could be food poisoning. So this would be more what they would call post-infectious IBS, and that can also lead to SIBO. So sometimes the bacteria that causes the food poisoning, or all the time, is also going to impact your microbiome. So I wouldn't necessarily say this is a completely separate issue. Typically, it would be a case of food poisoning that then leads to dysbiosis. But again, this is why doing a thorough intake is so important for treating gut-based issues, because we want to know these things. Has the person had food poisoning? Do they have history of antibiotic use? Because in knowing this and understanding things that have led the person to be where they are, that's also going to guide a lot of our treatment protocols. And if we negate to look at these, I could give somebody a supplement protocol or herbs and they might see some relief in symptoms or they might even get better. But if we didn't address why they got there, they're probably not going to stay better. So again, this is really important to look at. Another reason why somebody could have IBS symptoms is post-infectious IBS leading to dysbiosis due to food poisoning. Number 3 is intestinal permeability. So we used to call this leaky gut, but that's no longer acceptable. So we call it intestinal permeability. What the heck is that? So it's actually pretty incredible when we think about the lining of our gut and intestines is only one cell thick, and we have this mucosal membrane. So it should be held together by tight junctions, meaning there's not a lot of space. What's supposed to be in the gut and the intestines is staying in there, and what's out of there is staying out of there. But what happens when we have inflammation or we have dysbioses or we're eating foods that we're really sensitive to or we're eating specific types of foods like gluten is these tight junctions start to separate. And then we have space in between the junctions where what's supposed to be in the intestines and the gut is no longer held in there, and it's able to pass and permeate into the bloodstream. And once it's in the bloodstream, we have things like antigens, undigested food, pathogens passing from the intestines and gut into the bloodstream. We're going to have a lot of systemic issues because when something's in the bloodstream, it's going to travel. It's not going to stay there. Stay exactly where it is. So then we're seeing a lot of things like skin rashes, acne, headaches, some of these things that are passing, including something called lipopolysaccharides or endotoxins, can actually pass the blood-brain barrier as well. So now we're dealing with neuroinflammation. So intestinal permeability or this leaky gut issue can cause a lot of systemic issues. And when we're relating it to stomach pain and changes to bowel movements, we can also see those as symptoms. And typically people with intestinal permeability are also having a lot of food reactions. So a lot of sensitivities, or they feel like they're just reacting to a lot of foods that they eat. And the reason being is because your body is no longer able to really differentiate what's food and what's unhealthy because we have so much of this undigested food, antigens, pathogens passing into our bloodstream that your immune system is going to be on hyper alert, like, whoa, what is that? Is it safe? Should it be here? And that's going to cause a lot of food sensitivity reactions and even underlie things like autoimmunity. So again, causes of quote unquote IBS or the symptoms thereof, we have so far dysbiosis, food poisoning, intestinal permeability. Number 5 is other infections. So these could be things like parasites, candida, SIFO, small intestinal fungal overgrowth, worms, even like Epstein-Barr virus, any other sort of like bug, pathogen, or infection can occur in the gut and also drive these symptoms. So for example, parasites is a really common one. Parasites, more often than not, cause people to have stomach pain and a lot of diarrhea. Sometimes, not always, I'd say most of the time. Again, this is why doing an in-depth intake is so important for people who have parasites as a driving cause of these symptoms. They might have traveled somewhere like Mexico or, Southern America, and then they come back and they're like, oh, my stomach's been off, or I've been having a lot of bloating and diarrhea. But this is not always the case. Again, we can get parasites even from eating like raw sushi or salmon or in our environment wherever you are locally. But these other infections can also lead to stomach pain, changes to bowel movements, and therefore be a driving factor or a causative factor of the IBS symptoms and diagnoses. Number 5, we have brain and gut interaction issues. So this could be a whole podcast on its own. And this is why people who have the diagnoses of IBS, or one of the reasons, will say that stress is a really big trigger. When we have issues with vagal nerve tone, which is again one of the main nerves that's involved in your gut-brain connection, or I have a couple clients who've had traumatic brain injury or CNS injury. This is going to cause a lot of disruptions between your brain and your gut. And because they are so intricately connected, when we have disruptions to brain health, it also can influence the gut. And this not only goes to things like motility, which is the movement of food and stools through your digestive system, but also can lead to things like stress-induced diarrhea, where people will have like this stomach dumping or this release when they start to get stressed. And that really comes down to the gut-brain connection and vagal nerve tone. And then we also, if we want to get a little bit more, specific with it, we can look at things like neurotransmitters like serotonin and dopamine and the influence of that in relation to gut health, which we are not going to dive down that rabbit hole right now. But gut-brain interaction issues or disruptions to vagal nerve tone can also be a driving factor. And I also would like to take this time to say that I'm listing these factors as in like, could be this or that, but typically it's not just one, right? Like I'll often see clients who have something like dysbiosis or SIBO, and then they also have issues with, gut-brain interaction because they suffer from chronic anxiety or stress, which over time maybe led to some of the habits that also led to their dysbiosis. So again, at risk of sounding like a broken record. But again, this is why doing a thorough in-depth intake is so crucial, because we need to understand the interplay between these systems. And when we're creating a healing protocol or helping people to get better, really consider all of these individual factors and how they interact with one another. Okay, next up, we have IBD. So this is something that would need a colonoscopy or an endoscopy to be diagnosed. If I have clients who have diarrhea, especially multiple times a day, I always ask them to get a referral to go see a gastroenterologist to rule this out, especially if there's anything like blood in the stool. And these are autoimmune conditions. And so they would be able to be seen structurally on an imaging exam through either muscular hypertrophy, or we can see fissures. Sometimes there'll be like a cobblestone appearance for Crohn's. And then with colitis, we're more seeing ulcerations in the mucosa. So this again can be seen through imaging. And again, it could be like person has IBD, but they also have dysbiosis. So it's not necessarily one or the other. But this is something that's really good to rule out if you have been experiencing chronic diarrhea and you do also see blood in the stool. So this again would be something that you would need imaging for, colonoscopy, endoscopy. They'll also typically take a stool sample and sometimes do blood tests as well to give you this diagnosis. And that could be one thing that hasn't been diagnosed yet, or they haven't given proper testing, that is also driving the person to have stomach pain and diarrhea specifically. Okay, number 7. Last one we're going to talk about today is other systemic issues that influence digestion. So this could be gallbladder issues, poor bile flow, poor liver health, pancreatitis even, infections and inflammation. And these are more systemic things that are considered like periphery to digestion, but are very important for it. So one actually root cause or influential cause of something like SIBO is poor bile flow. So because we don't have this, we're not digesting our food well enough, and we're having undigested food that's just sitting and chilling in the intestines, and this is causing it to ferment, and now we have an issue of bacterial overgrowth. So something like a GI map, which if you listen to next week's episode, you're going to see what exactly that looks like. And I'm going to dive into like some of the testing that I run as a follow-up episode. You're going to see that this will give us lots of beautiful markers that give us more insight into some of these periphery issues. And as a functional practitioner, this is why, even when I run a GI map or when I'm helping a client who has an IBS diagnosis, I'm also asking for certain markers in the blood that are going to give us more insight into these potential inflammation or infection, sorry. So for example, one of them could be CRP or C-reactive protein. If I see a client's CRP come back elevated, this is telling us, okay, there's some sort of inflammatory condition that needs to be addressed. We can also look at things like liver enzymes and different markers for looking at pancreatic health. And this is why, again, it's so important to take a broader perspective view and to work with a practitioner who understands how these things interact with each other and can really look at all the different puzzle pieces to your health. Because even like I see this quite often is somebody will be given a diagnosis like SIBO. And it's like, okay, but SIBO is actually still a symptom. SIBO can be a cause of other things like IBS diagnoses or these symptoms, but we also have to look at why the person has SIBO. They didn't just, be born with it. So we need to look at all these other factors if we want to not only help our patients get better, but stay better and prevent things like relapses. So to kind of just conclude here, or to draw this all back together, IBS is a diagnosis based on symptoms. And when we look at why the symptoms are occurring, which could be anything that I listed, dysbiosis, small intestinal fungal overgrowth, candida, parasites, food poisoning, other infections, IBD, disruptions to the gut-brain axis. When we figure out why the person has these symptoms, which in relation to IBS are abdominal pain and changes to bowel movements, we can work on fixing those. And again, this is found through proper testing and working with a practitioner who will do a full in-depth analysis of you, what you have going on symptom-wise, your history, and your lifestyle. We can really help to heal the reason why you're having the symptoms and you no longer classify as an IBS diagnosis. So is IBS a bullshit diagnosis? I would argue, yes, it is a cop-out from figuring out why we have these issues. And once you figure out the cause of them and work on healing that, you no longer classify. So can it be cured? I will also say yes, and you will no longer again classify as having IBS as a diagnosis. So thank you so much for listening to today's episode. I hope it was valuable for you for understanding a little bit more about IBS and exactly what that is and why we say that it's kind of a bullshit diagnosis. If you have been given a diagnosis of IBS, I highly suggest working on figuring out why you have those symptoms, healing those so that you can live symptom-free and no longer have that diagnosis attached to you. It can be a difficult journey, but when you have the right support, it makes it a lot easier. So if you have been feeling stuck or frustrated on your journey or like you weren't given any help, just know that there is hope and that if you keep looking for answers, you will find them. Tune in next week where I'm going to be going over different types of testing that I run in my practice, or specifically one test that I run quite often for GI issues, talking all about how it can be beneficial. And I'll even, if you watch the YouTube video, walk you through a couple case examples of that. So I'll see you guys next week. Thank you so much for tuning in, Wellness Gang.